and Musungu, KTN, Nairobi.
Now, nurses are the most affected health workers as they risk losing their jobs in level 3 and 4 hospitals 1 year since the rollout of the Social Health Authority.
In a survey conducted in 293 hospitals countrywide, 36% of health facilities reported to have laid off at least 5 nurses in the last 1 year. 7 out of 10 of them believe that the now-defunct NHIF, which is the National Hospital Insurance Fund, had better services compared to SHA.
As Winfrey Owino reports, NHIF debts and technological hitches are the main stumbling blocks in the SHA implementation.
1 year since the rollout of the Social Health Authority to replace the National Hospital Insurance Fund (NHIF), and a survey conducted in 293 facilities, predominantly privately owned facilities, shows that 74% of facilities believe that NHIF had better services than SHA.
We wanted to find out whether there has been any changes in the workforce, their employees, the type of employees. We wanted to find out if these facilities have had to borrow or take loans, or whether they have expanded or opened new facilities, or maybe reduced the number of services.
An expert in the health sector warns that level 3 hospitals that offer outpatient services risk shutting down over delayed funding, saying they are yet to receive funding for August and September.
Hospitals that are facing the most dire threat of closure are level 3 hospitals. And level 3 hospitals are health centers. These are the main hospitals in our villages.
In the survey, health providers complain of technological hitches that delayed submissions, as majority expressed their dissatisfaction by the digital integration. However, slightly more than half of the respondents use SHA only for payments. As per the survey, which was conducted between September 12th and 30th this year, the burden of pending NHIF debts led to delayed supplier and salaries payments, reduced services as other institutions closed some of their units, such as maternity and outpatient services, while others shut down completely. Generally, slow claims processing, credit delays, NHIF debt burden that led to most facilities borrowing to stay afloat hindered service delivery in the last 1 year.
Job opportunities in the healthcare sector since SHA began have actually shrunk. And when you look at the detail, which cadres of personnel were most likely to lose jobs, what we found out was nurses. Nurses were most likely to be affected because 36% of the facilities surveyed told us that they had laid off more than 5 nurses in the last 1 year.
Therefore, the survey has recommended the authority to fix the system to achieve at least a 10% downtime and publish verified NHIF claims publicly and clear them in tranches. Despite the criticism, SHA's packages have a broader service coverage on paper, with specialized funds for primary care, inpatient and emergency services as compared to NHIF. However, its effective implementation remains elusive. Winfrey Owino, KTN.
Staying with